Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I'm the prenatal and pediatric chiropractor here at the CAP Wellness Center. And on today's episode, we have Higa. She's back. She's our acupuncturist here at the center. You've heard her other episodes, I'm sure, around pregnancy care and postpartum support that she does as an acupuncturist here. But today we're going to be talking about fertility. You know, Maring and I have been working together here for a couple of years now, and I've really seen her fertility practice really blossom. She's become quite an expert around here in town, helping lots and lots of couples get pregnant. And it's not just because she's an expert in acupuncture, although traditional Chinese medicine obviously is very powerful in helping couples get pregnant, but it's a holistic approach that she uses along with a traditional Chinese medicine, and allow her to share that holistic approach here. It's her Fertile Ground workbook and workshops that she teaches, and she's going to walk us through all of that work and how powerful it can be. So before I jump into that conversation, obviously, as always, I want to take a word from our sponsor, the CAP Wellness Center, and then we'll get right into it.
Hi, I'm Higa, and I'm the acupuncturist at CAP Wellness Center. One of the things I love about working at CAP Wellness Center is getting to be around all the brave, strong, and inspiring women. I'm always inspired by my patients' ability to rise to their challenges, overcome obstacles, and also get creative in their pursuit towards their health goals. I feel honored to be a part of their journey, whether it's helping them to start a family, have a healthy pregnancy, or helping them through their postpartum recovery.
All right, let me introduce Higa to you once again, and then we'll jump into our conversation. Natural medicine has always been an integral part of Maring's personal journey. Combined with a Master's of Science from Pacific College of Oriental Medicine and a psychology degree from Naropa University, she studied extensively in the area of infertility, pregnancy, and postpartum recovery. And in 2005, Maring even traveled to Chengdu, China, to intern with some of the best gynecological doctors in the world. Maring specializes in both female and male infertility as well as pregnancy and postpartum support, and continues to study the most up-to-date information in this field. She's also a creative strategist coach and a podcast host, and loves bringing together wellness and creativity in the work she's doing. So with no further ado, let me switch over to my conversation with Maring. Hello, Maring. Welcome back to the podcast. How are you?
I'm good. How are you?
I'm doing great. I'm glad to have you back. It's been quite a while since I've had you on the podcast. We've been working together for years. I mean, literally years now here at the CAP Wellness Center, and we've did a bunch of different episodes around specifically acupuncture and helping things. And today I'm really excited to talk to you about fertility. I mean, it's something that I've seen you grow and evolve this aspect of your practice over these last couple of years and become really quite an expert in a comprehensive view of fertility. So I'm glad to have you on today and have you share that with us. Before we do that, though, and jump into it, for those of you who haven't listened to our previous episodes, you can scroll through our list and see Maring. She's talked about pregnancy and acupuncture, but Maring, give us a little bit of your background for those of you who aren't familiar with you yet.
Sure. So I'm so excited to be doing this and sitting on the other end of the mic. I am an acupuncturist. I specialize in pregnancy, fertility, and postpartum related issues, and I've been doing that for the past 10 years. And what's really cool is that I've been able to sort of explore the, many different avenues of fertility, from working with people that are in the IVF community, the people who are doing IUIs, to the natural community, and now sort of coming to my own way and adding my own things that I've seen have been really beneficial for women who are trying to conceive, even men who are having difficulties with sperm issues, and adding a component that I think is a little bit missed in at least in my practice. And so I've created a course now that's called Creating Fertile Ground. It's a workshop, and now I also have a workbook to go along with that.
And this work that you were creating that's really evolved is so much more comprehensive than what most couples, I will say, not just women, are going through if they're trying to get pregnant. Tell us how that's evolved and how you've really, put in creativity and concepts of receptivity into the work you're doing with couples that want to get pregnant.
Yeah. So, I work on the way I was trained in acupuncture and Chinese medicine was very, one thing. It's looking at the body, right? So we're looking at symptoms, and we're looking at the BBT chart, and for lack of words, I guess it's more of a clinical kind of approach, which has been great. But I started to see that, even my patients were coming in and they were saying, oh, I downloaded this great meditation, or, I've through this process, I found that I'm drawn to painting. I'm really into writing right now, or decided to take this course on whatever this kind of lingering dream was that was kind of going alongside this desire to have a baby. And I just felt was seeing better results in their outcome in terms of having a baby. And then sometimes these women were actually not getting pregnant, at least during our time together, but they were like, it's okay, because I actually found this amazing passion for this business I have, or actually found this amazing connection with my husband. And so I really started delving more into that, and kind of digging deeper into that process and why that was effective, and sort of my research and my own personal process and interviewing my patients. Fertility is really all about reception. So we as females are, we're the vessel, right? The sperm comes in, it meets the egg, and then we hold a baby for 9 months. And I think that creativity also goes hand in hand with that. So the pushback, I think, or the thing that I was noticing, is that we live in this world that is very sort of mixed messages. We're getting this message that we should be, high-powered women and know what we want and do all the things and go after all these dreams and do and take care of the kids and look sexy. And there's just a lot of pressure, I think, for women specifically to do it all. And that is actually more of a masculine kind of way of being in the world. And women are actually designed to be more feminine. It's better for us and our energy and our efficacy in the world to actually be receivers. And so when we're running so much masculine energy, when we're doing all these things, we have a hard time being able to receive. And then in turn affects our fertility. Did I answer your question?
Yeah, no, absolutely. Because I think most women, when they're pursuing fertility, and I would imagine that most women who are interested in fertility are ones that are having initial challenges of it, right? Tend to just pursue the physiological reasons. And it's important to do so, of course, right? And I think that's what you're saying about your training, is that you're looking at blockages in the body somewhere that might be preventing the sperm hitting the egg, or the egg implanting, all those kind of physiological reasons. And then if those physiological reasons are explored and there doesn't seem to be anything, quote, wrong, a woman is left by themselves to do something different. And that's, I think, what you're adding in, is that whole other deeper dimension of things. And with the different, say, like the Creating Fertile Ground, when do you like starting with women to really kind of explore these type of issues?
In a perfect world, right? I almost wish I had these tools before I started to have children myself. And there's this whole movement around conscious conception and it's not just for people who are having difficulty trying to get pregnant, but also like having some consciousness and awareness before we start the process of trying to have a baby. And I think that if we do that, it's not just with fertility, but, if we do that with any intention in our life about buying a home or moving, changing a job or anything with that sort of intention of like, what am I creating? What am I wanting? What does the long-term view look like? What kind of feelings am I wanting? What kind of connection do I want with my partner? Like all of those things are, in a way, sometimes I think for these fertility patients is a blessing that they get to have this process and think about these things and go through that emotional strife, because a lot of times we get pregnant and then we learn along the way. Oh, what do I want? What's this going to look like? How is my relationship going to be with my partner and all those sorts of things? So ideally, it'd be great if we started to think about these things before we had a problem, let's say.
Right.
But if you've been in this process for 6 months, a year, 2 years, sometimes, even longer, it's a great time to kind of come back to these questions. And that's really what this workbook and why I created it. It's just 4 weeks, and it's these prompts of exercises that really help you kind of tap into, visualization and collaging and like, having dates with your, child that's to come into this world. And it's really tapping more into the creative side of things, which again is sort of this little trick, I think, to help us become more receptive and more fertile. So, to answer your question, I think that there's really no wrong time to start. I just like to, part of the work I think I'm doing is trying to encourage people to do that earlier, try to think about fertility earlier in life.
Right. And it's not like, say, a woman or a couple has been through a fertility process, they're going to have to start all over again doing this process. It's an addition to amplify the efforts that are a couple is going through.
Yes. Yeah, absolutely.
And do you find like as women are going through this process, say in this, in the 4 weeks of the creating fertile ground work that you've created, that a lot of the barriers are coming up for these women, recognizing, okay, this is an area like I can't do this exercise, all this stuff is coming up for me. And then that allows a woman to jump into that aspect to see and explore what might be blocking a baby coming in.
Yeah, it's really interesting what comes up. There is a little bit of that, but I would say that the exercises are not necessarily, the workbook are not necessarily meant to kind of create resistance, I guess, is what you're asking. It's more about exploring what the joy around it. Because I think part of what people in the infertility community they are really good at following rules. They're really good at doing all the things you're supposed to do. They're really good at being hard on themselves. And so part of it is actually about softening. Part of that is about allowing. Part of that is about not looking necessarily at the resistance and saying like, this is one more reason why I'm not doing it right.
Okay.
And the workshop, why I'm creating that, what we're doing, coming up is, I want to create community for these women and be able to do that in a safe environment. And also, if there are resistances that come up, that you have, the support of people around you and showing you that maybe those are the same resistances they come up with, but giving them an option of a way to soften around that and a way to kind of develop some self-love around that, because that is hard. This journey for them is hard. It's hard every single month that they don't get a pregnancy test back coming positive. And rarely do these women have people to talk to about these things. Sometimes I'm their only confidant, and they long for a sense of understanding and a sense of belonging, yet at the same time, they don't want to share their story and feel pitied. So a lot of, I mean, I created this not to be another thing of like, here's another way you can fix yourself, but here's another way you can think about it. Here's another way you can find joy within it. And I feel like what's amazing is I had a patient do it, and she had been trying for a long time, like 5 years. And we did the Fertile Ground workbook, and she would email me every week, like, this is what I did. And one day she said they love camping, and she wanted to go. She went to Target, and she was on the week where you were supposed to buy something for your intended, your baby essentially. And so she went in and she saw this onesie, and it was like something about like camping. It's this like cute little camping onesie. And she looked at it and she was like, no, I'm not going to buy it. That's silly. And she left, and it kept nagging her. And she wrote to me, and she's like, went home, and I had to drive back and buy this onesie. And she's like, I don't know why, but it gave me so much joy. And, our stories, we don't know how they're going to unfold, but her story is that, they are in the process actually of adoption, and they're very excited of it, and I know that when we hear things like that, especially if you want to carry a baby and get pregnant and all of these things, that adoption or any of these other options of how we might have a baby sounds like failure, or sounds like, that's not what I want.
Second best.
Second best, yeah. But for her and her process and her journey, that was the right thing. And this is something that kind of helped her get there. Finding some joy around the process is, really huge. It's a huge, huge thing for these women. And I just want them to find more spaces, not just here, that they can feel not judged, not like I'm going to tell them one more thing they need to fix, Right.
And in this specific case you're talking about, did she feel more at peace about being in the adoption process rather than feeling like, okay, well, it's enough time trying to get pregnant, I guess we're going to have to go the adoption route?
No, she felt so happy, ecstatic about it. And, I think that they had tried a lot of options. They had gone to IUI and IVF, and it just, there's many reasons why sometimes you can't carry your own baby. And if the desire to have a baby is the goal, right, there's lots of options and other ways for that to happen. And I'm not minimizing the grief around that at all. I know that is hard. And I've seen that be hard, and I've listened to stories, and I've held people's hands, and I let them cry on my shoulders. I know that's hard. But for her situation, it was just kind of, I think she kind of worked through this process through the workbook and, other things that she was doing, and kind of saw that she was destined to be a mother, however that was going to happen. Right.
And then had a stronger resolve to however it is going to happen is great. So we can start the journey of parenthood rather than it has to look a certain way.
Yeah. Yeah.
And I've heard so many stories of couples that have been trying to get pregnant for a long time, go to adopt a child, and either in the process of adoption or right afterwards, they get pregnant. And there's something about that, the field is created for, okay, yes, we are parents, I can do this. There's some kind of blockage of it's being more real that allows that process to happen, and nothing physiologically changed with them. There's something emotional and something in the energetic that's changed.
Mm-hmm.
And
absolutely.
if you're able to walk the people through this process, then that kind of restraint or grippedness about it of all right, so I'm ovulating right now, let's, we have to have sex right now, instead of allowing a process to happen, I think is much more, more fun as well as probably successful as well.
Yeah. Yeah. I think that, I think all of what you said is true. And a lot of, telling a woman or telling anyone, maybe I'm just generalizing with women, but that, you just need to relax and let it be, or receive, or, is like kind of an abstract concept, So I think
easier said than done.
Yeah. And just helping people give framework around how do they do that. I think for myself, I can speak personally. It's just when someone says like, well, just let it be, or relax, or, these things, I'm like, but how do I do that? And then even in the language, right, around it is, how do I do that? Like, what can I do to make that happen? And a lot of receiving is about not doing, right? So that paradox of like,
right.
How do I work through that?
Well, I'd love for you to share too, with our listeners, the work you've been doing with fertility doctors, with medical doctors. I just love hearing these stories of, one, how receptive the medical community is to working with you around it, and a lot of the feedback you got around from these docs. And like, this is so much more comprehensive, not only just with the fertility work, but then also being open to acupuncture.
Yeah, that has been so cool for me, that I've had a chance to visit now a few IVF clinics, and I did a presentation recently with 4 IVF doctors, and presented sort of my take on what I think is missing in the fertility experience, especially if you're doing assisted IVF or IUI. And so I gave this talk, and I basically was saying, these women have so much going on, and the IVF process is intensive. Sometimes you have to be there every single day. And they're taking drugs, and they're taking shots, and they're doing this, and they're stressed with it, and it's expensive, and blah, blah, blah. And when people come and get acupuncture, what they're receiving a lot of times is the ability to have a listening ear who's going to listen to them for, 15, 20 minutes, and then let them relax on the table so that they can let that stress go and that anxiety go and have a place for that to land. I mean, there's just this whole piece that is not just part, they said, well, it's so great that you're doing this work because you're part counselor and then you're part helping them on the physiological level. So acupuncture helps to bring more blood flow to the areas that need more blood flow, the uterus, the ovaries, the fallopian tubes. And also it helps turn off that sympathetic nervous system. So when we're under stress, when we're any sort of stress, just even driving in a car, we're going to have that fight or flight mechanism slightly turned on. But when we're dealing with all these other things on top of it, we're definitely overwhelmed with stress. So they were really receptive to hearing that. And they, I think, they knew that there were limits to what they could do. They're doing surgery and they're doing all these procedures, and they know that is a needed thing. However, like that clinic is not, and most clinics are not set up to provide that other piece of it. So they have their own acupuncturists. I mean, they were so receptive to acupuncture and seeing that their patients benefit from it, their outcomes benefit from doing that. And I got to go back and go, see some surgeries done. And they were more than willing to show me around their facility. So I just love too, when we are, Western medicine is amazing for so many things. And, all these adjunct therapies, I think, are amazing as well. And when we can kind of see each other, as equals, I guess, or as beneficiaries to each other, everybody benefits, right? Our patients benefit, we benefit, it's just a better, more comprehensive way to look at health and wellness.
Right. And it's such a changing times, right? That these IVF doctors were wanting to bring you in to learn from you, rather than it being, we're the doctors, this is what we do. And it also shows these clinics that are bringing you in, how really committed they are to serving the patients they're working with, and that they really want them to get pregnant, and do anything that it can take, and offer a comprehensive approach working along with an acupuncturist that's also doing this fertile ground work that offers more to the people that are coming to them, so these couples can get what they want, which is to become parents.
Yeah. It's really cool. Yeah.
So when is this workshop coming up? Tell us details and how listeners can find more about it. And then also I want to make sure they know how to get your Fertile Ground workbook.
Yeah. So the Creating Fertile Ground workshop is Sunday, May 21st, and it's from 12 to 3. And it'll be part creative exploration and part practical tips. So the things that I share with my patients that are like at-home remedies that I send them home with, you'll also be learning that as well. And yeah, it's $49 payable at the door, and you can find it on my website at merinhiga.com/courses. And there'll be a link on there to sign up.
Okay, and I'll make sure I'll have that link available in the show notes and on the website for you to click through and find out more about it. And then how can they get the your workbook?
Oh yeah, so the workbook is free, and if you go on my website again, it's Higa Acupuncture. Sorry, I gave the wrong website first. It's meringhigaacupuncture.com. And if you just click on the first page, you will see a sign-up form, and it says "Get your free workbook." And that'll send it right to your email.
Okay, excellent. I also, before we finish up too, want you to tell people briefly about your podcast. You're a fellow podcaster, and I want you to let people know about it.
Yeah, thanks. So speaking of creativity,
Yes.
that's definitely my where I function from. I'm 80% creativity. So I started a podcast basically talking with creatives about the messy middle, I call it, and the magic we make within it. So it's really talking about creative process and creative business. And a lot of what we kind of talked about today, more from the side of like making art and doing things. And we're just ending season 2 and about to start season 3. Some amazing artists on there, authors and singers and movement specialists. There's just kind of this array of amazing people on the podcast. So yeah, have a listen. It's right now, currently it's called Special Circumstances Podcast, but actually season 2, it will be called The Messy Middle Podcast. But you can also find the link on my personal website, merinhiga.com.
Okay, yeah, I'll make sure all those links to the workshop, to your workbook, and then also to the podcast are included. Well, Mering, thank you for being here. Thank you for sharing all this information. Listeners, please reach out either through the capwellnesscenter.com website or a Facebook page, or directly through Mering's website to learn more from her and to get more involved. If there's something that inspired you from this talk and you'd like to work with Mering more closely, please reach out. So Mering, thank you again for being here.
Thank you.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.